All right, so getting to our different types of drugs, adrenergic agonists are going to be drugs that bind to adrenergic receptors and activate them or change stuff in the cells. So they act like norepinephrine or epinephrine. Sometimes these are called sympathomimetic because they mimic sympathetic autonomic response. And so they activate one or more of these adrenergic receptor types. If you remember from the last one, there are four that we're going to be talking about: alpha 1, alpha 2, beta 1, beta 2. They can stimulate in one of three ways. So one, they could be direct acting. So we'll talk about some of these drugs that are direct acting, and it sounds just like that. So it binds to the receptor and it causes the change. But we also have indirect acting. So they do something that stimulates the release of whatever that natural chemical is. So in this case, we're talking about adrenergic. So it'll stimulate the release of norepinephrine, amphetamines, right? Or it can be mixed acting. So it does direct and indirect. So they can stimulate the release of norepinephrine, and they can also stimulate the receptor, kind of like ephedrine does. So, the four most common adrenergic receptors: alpha 1, alpha 2, beta 1, beta 2. What do? Alpha 1s, working on smooth muscle and sphincters causing contraction. Beta, or alpha 2s, found on adrenergic receptors, working like a negative feedback mechanism. And then you have your betas. Beta 1s working on the heart, increased strength, contraction rate. Beta 2s working on smooth muscles, vasodilation, bronchodilation, that kind of stuff. So, albuterol is probably a drug you've heard of, especially if you have asthma. So albuterol, it is a beta 2 agonist. So its job is to bind beta 2 receptors. And it's used in asthma, bronchitis, and bronchospasms. It causes the dilation of those bronchioles, right? Side effects is it can give you nervousness or restlessness. When people take their inhaler, they might even get a little shaky from it because it is still sympathomimetic, right? It is acting like your fight and flight system is being activated. Clinical concerns or contraindications, stuff that you need to be aware of is you should not be giving albuterol or Adderall to people who have severe cardiac disease or hypertension. It could put them in an hypertensive crisis, which we'll talk about later. Epinephrine, EpiPens, may have heard of those, right? When do you get an EpiPen? When you have an allergic reaction. Also, in cardiac arrest, to start somebody's heart again, you can give them epinephrine. It's going to stimulate both your alphas and your betas. It's just worldwide going and binding, okay? Side effects, again, nervousness, agitation. Clinical concerns, don't give this to somebody who has a cardiac dysrhythmia, so if they have something wrong with their heart rhythms, probably shouldn't be giving them epinephrine unless their heart has stopped, and then that's better than a stopped heart, right? And then we have this whole group of sympathomimetics. So norepinephrine or Levophed is an alpha agonist, so it's going to bind your alphas, 1s, and 2s. You use it to increase blood pressure. So if you remember, alpha 1s constrict blood vessels. And so if you're constricting it, it's squeezing it, and it's increasing the blood pressure. Some side effects you should watch out for is if you're injecting this into somebody, you need to make sure you get it deep enough because it can cause necrosis at the injection site. Necrosis is cell death. It also decreased urine production. So if somebody who is not urinating enough, you probably don't want to give this to them because then they will be urinating. even less. Clinical concerns, it is, again, sympathomimetic, so heart disease, also people with renal failure, if they're having trouble with urine production in the first place, you don't want to be giving it to them. Pseudoephedra, Sudafed, probably taken this. Back when I was a kid, you could just pick it up off the shelf. But now you have to go see the pharmacist in the back because it's also really good at making meth, which is an amphetamine, right? So with your Sudafed, it is an alpha agonist. It's a nasal decongestant. So the way Sudafed works and a lot of your decongestants is it causes the vessels in the lining of the mucosa, like around the nose, to constrict. So they get smaller. That means less blood, less fluid for your mucosal cells to make mucus. And so it helps to dry out your nose by constricting those blood vessels. Again, restlessness, nervousness, dizziness are common side effects. Again, don't give it to people who have hypertension or high blood pressure. Be careful with people with diabetes. It could be contraindicated for that. And then again, people with hyperthyroidism, be careful. So this thing is going to raise your heart rate, probably raise your blood pressure. Hyperthyroidism is really important, or your thyroid's really important in metabolic control, and these two things don't really go very well together. So careful if somebody has hyperthyroidism, giving them Sudafed. And then Visine, tetrahydrozoline, is also an alpha agonist. Still going to be constricting those blood vessels. It's an ocular decongestant is what they refer to it as. Side effects, eye pain, headaches, buzzing in your ears. If you have buzzing in your ears from Visine, you should probably stop using it. Clinical concerns, don't give it to people with eye infections or closed angle glaucoma. Not angle. Cool. So we also have alpha adrenergic blocking drugs, alpha blockers. And we talked about how alpha 1s constrict stuff. So if you block it, it's going to relax things. And it really, these alpha adrenergic blockers are used to relax smooth muscle. So we see alpha adrenergics, or alpha adrenergic blockers, alpha blockers, used to treat high blood pressure, because we talked about how alpha 1s can constrict it. So if somebody has high blood pressure, they can take an alpha blocker and dilate those vessels. People with Raynaud's disease, this is decreased blood flow to the extremities. And so if you are dilating those blood vessels, that should increase the blood flow to the extremities, at least counteracting some of those symptoms of Raynaud's disease. Pheochromocytoma. Pheochromocytoma is a tumor found in the adrenal medulla, causing an overproduction of catecholamines, epinephrine, and so you take an alpha blocker to hopefully combat some of the effects of having too much epinephrine, too much adrenaline in your blood. And then also benign prostatic hyperplasia. Benign prostatic hyperplasia is a enlarged prostate, which makes urination difficult because you have a prostatic, or males have a prostatic urethra that runs through the prostate, and then the membranous, and then the spongy. So some of these, minipress or prazosin, alpha antagonist. Again, all of these are going to be alpha antagonists, right? This is one that is used in hypertension. So minipress helps to decrease blood pressure. Side effects, dizziness, headaches, lack of energy, dizziness, especially when standing up. That's something called orthostatic hypotension. So when you stand up, if you have this alpha blocker, it's not going to constrict those vessels and raise the blood pressure. And so you might get like that tunnel vision, or like feeling like you're going to black out. Also, don't take it if you've had cataract surgery, especially if you have like a floppy iris, because it causes the contraction of those sphincters, and it causes your eyes to dilate, is what your alpha normally does, and without it, it won't be able to dilate. The next one's Flomax, or tamsulosin. Again, alpha antagonist. This one is used to treat the benign prostatic hyperplasia. So with that enlarged prostate, it makes it hard to urinate for males, and so taking it can cause the smooth muscle in the urethra to relax to make urination easier. Side effects, one is it has first dose syncope. First dose syncope. Syncope is just a fancy word for dizziness, and I'll use those pretty interchangeably between dizziness and syncope. But early on, when you first start taking it, you might get dizzy, but over time it goes away. Another is priapism. This is a really long erection. So if you've seen the Viagra commercials or whatever, it's like if you've had an erection for more than 4 hours, priapism, a really long erection. So this drug can do that. Again, it's relaxing the smooth muscles. It can cause the penis to fill and engorge with blood, which causes an erection. There are ways to counteract that. I guess like after a while, it becomes really painful. Concerns, again, people with liver disease shouldn't take it. People who are going to be under general anesthesia shouldn't take it, and people who've had coronary artery disease, not disuse, should not take it. All right. So, something that we come across with any of our blockers, both our alphas and betas, anything that blocks the sympathetic effects can look like an increase in the parasympathetic effects. Okay? So you might see pupil constriction or miosis. You might see nasal congestion, increased GI action, reflex tachycardia. Sometimes people get on these drugs for heart issues, especially like beta blockers. And it's like it's supposed to decrease the work on the cardiovascular system, but sometimes it causes reflex tachycardia, which means your blood pressure drops and your body starts freaking out like, it's not supposed to be that low. And the sympathetic gets activated. When initially, the whole reason you're on that drug is to block the sympathetic activation. And so it gets it overactivated, and you get something called reflex tachycardia. We'll talk about beta blockers in the next group.